day, all of you. I'm Dr. Ram Sai, pediatrician, senior consultant practicing at Hyderabad since 10 years. So, nice meeting all of you. Today, on the occasion of World Digestive Day on 2023, I would like to pass some pearls of knowledge about the most important system of our body, that is the digestive system. Some call it as the gastrointestinal system. That's about the health, about the gut, right? The gut is very important nowadays. Even the trend has changed. The gut health starts even from the womb, from the baby, from the fetal life. It's called as the first 1,000 days. As you know that our famous, the great Greek philosopher said, the Hippocrates said, the diseases all begin in the gut. Almost 70% of our immunity lies in the gut, right? So what you eat is what your brain. Not only that, the mental health all depends on your immunity. So what we eat is very important. Nowadays, with the changing trends, with the lifestyles, the disease more becoming obvious during the pediatric ages are the constipation, which we are all observing, the hyperacidity, which were almost minimal during the past days, the diarrhea. Yes, nowadays diarrheas have came down. So the priority wise, the constipation is increasing nowadays in the pediatric age group. They're consisting about almost 70% of our cases. The hyperacidity, 40 to 50% of the gastrointestinal cases are due to hyperacidity. Yes, the diarrhea comparatively has gone low due to might be our vaccines, the rotavirus vaccines, and the development, the water improvement in our sanitary system. Okay, so the first 1,000 days starts from the womb, they say. Next, today we will discuss about the things how we can improve and decrease these problems. The decreasing is by exclusive breastfeeding till 6 months of age, and then after the 6 months, slowly introduction of the complementary feeding in a graded fashion by continuing of breastfeeding. So this is the most important thing to maintain the gut health. And second thing, cultivating a good feeding practices at home, like the parents being the role models, like not eating any junk food. They set an example to their kids. So the complementary feeding starts at 6 months and it continues till 2 years also. So parents being a role models has to have a good healthy living habits, right? And cut down the unnecessary excess fats. And water intake should be good. And with the developed nations, they have cut short these things by giving they're opting for good probiotics and avoiding of unnecessary antibiotics. These are the things which would help to maintain a good gut health. In spite of these things, the child is suffering from any gastrointestinal problems like constipation, diarrhea, abdominal fullness, uneasy, fatigue, fussy eating. I think they should better consult a pediatrician whenever they find these symptoms, in spite of taking all the care. So I would suggest every one of us, and I would advise to invest in the child gut health and improve overall health of the child. And they say that early origin of childhood origin of adult diseases. So maintaining a good gut health by using appropriately the probiotics, taking care, avoiding unnecessary, unwanted junk food, and opting for a healthy lifestyle will make a good, healthy adult.